Hello my dear friends, I am Dr. Vardhaman K, the Director of Asian Eye Hospital and a cataract and spectacle removal refractive surgery expert. Asian Eye Hospital and Dr. K family are considered as one of the pioneers of spectacle removal surgery in India. We have been doing spectacle removal procedures since 1985 and we have pioneered several advanced technologies in India including PRK, Lasik, solid state Lasik, bladeless Lasik or a femtolasik procedure, a relax smile surgery, Contura and the current generation of Evo ICL procedures and have removed spectacle numbers right from 0.5 to as high as minus 30 diopters, which is considered to be the highest spectacle number ever removed in the world by US FDA approved procedures. Asian Eye Hospital has been recently awarded as the best LASIK center in India by the Governor of Maharashtra, His Excellency Shri Bhagat Singh Koshyari at Raj Bhavan in Mumbai. So far in our journey of 37 years, we have performed spectacle removal surgeries successfully on more than 1,10,000 procedures and our name stands in the Limca Book of World Records for the highest number of LASIK surgeries done in one day in the world. Friends, we all know, especially all my friends and patients who have been using spectacles since long time, that the spectacles are considered as obstacles. Spectacles take away your freedom of vision in your day-to-day life. But along with that, it is also known to have and hamper your possibilities for job opportunities, such as if you want to join Army, Navy, Indian Air Force. So these are some of the reasons why some of our patients choose to get away from spectacles and achieve the visual freedom that this variety of procedures they offer to our patients. These procedures of spectacle removal are collectively called as refractive surgeries. Usually when it comes to spectacle removal procedures, they are divided broadly into corneal laser-based procedures and lens-based procedures. Corneal laser-based procedures include advanced surface ablations, bladeless Lasik surgeries, Contura procedures and smile laser procedures, which are currently known as the most advanced lasers in the world. However, for many of the patients, the lasers on the cornea are not deemed suitable, and for all these patients, a new and a very promising technology which is known as the lens-based procedure in the form of Evo ICL is one of our preferred choices for all these patients. And in this video, I am going to take you through all the details of this Evo ICL procedures, which is certainly one of the best surgeries that we have in the world today when it comes to visual freedom. Evo ICL is the latest generation of ICL lens-based procedure. ICL means implantable collamer lens. This is also called in many lay people as the implantable contact lenses. The way our patients use contact lenses on the cornea, consider this to be a surgical, very thin, very delicate contact lens which is implanted inside the eye in a very short time. It takes only 5 minutes with very small incision which is approximately 2 millimeters with a very quick recovery. This lens is implanted behind the iris just in front of your crystalline lens. This is how the lens looks. This is the model of the EVO lens. Of course, this model is many folds larger model than your own natural EVO lens. This EVO lens is extremely delicate. It is hardly 100 micron in thickness. Therefore, it can be implanted with very small incision very quickly and atraumatically. This lens is made up of a material which is called as collamer, which is the patented technology by the Star Surgicals. Collamer means polymer of collagen fibers. Therefore, the material of this lens is akin to your own body's collagen fibers. Therefore, the lens is accepted in your body as its own and does not get rejected and can be left in your eye for many decades without any issue at all. So let us talk about what is the eligibility criteria and patient selection for the Evo ICL procedure. Evo ICL can be done on any patient between the age of 21 years to 60 years with a stable refraction for at least 6 months, especially in patients who are not deemed suitable for corneal laser surgeries, which include anyone who has a refractive error more than -8 myopia, or patients who have possibly lower grade of prescription or myopia but whose corneas are not suitable for corneal laser surgeries, such as patients who have very thin cornea, patients who have weak cornea where the laser is not safe, such as patients who have keratoconus or patients who are keratoconus suspect, or the patients who have moderate or severe dry eye. However, with the current generation of Evo ICL and with its advantages, in many countries such as in Japan, Evo ICL is slowly replacing the laser surgery as the primary option of spectacle freedom in vast majority of the patients, even if their spectacle numbers are lower than -8 and in spite of having excellent corneal characteristics. Now let us talk about the advantages of the Evo ICL procedures versus the corneal laser surgeries as such. Evo ICL procedure has 5 important benefits over its corneal counterparts. Number 1, Evo ICL procedures does not induce any dryness. Therefore, it can be safely done on patients with pre-existing dry eye, and it is especially important in current generation of computer users. Second, Evo ICL procedure is known to give much better sharpness and the quality of vision, especially in high myopic corrections compared to the Lasik surgery. Evo ICL procedures is also known to have more stable outcomes over the years versus the lasers. The chance of regression, that is chance of you getting your prescription back with the Evo ICL, is seen to be at least 5 or 10 times lesser as compared to the Lasik procedures for patients especially who are having high myopic prescriptions and require corrections. The fourth advantage of the Evo ICL procedure is the nighttime vision is also superior to the corneal laser surgeries and maintains the contrast sensitivity and the quality of vision in very low light conditions as well. And the fifth advantage is that it does not require any thinning of the corneal tissue, which is done in the corneal lasers. Therefore, it is actually safer than the corneal lasers, especially if the cornea is thinner or it is weaker. With this, I will come to the most important advantage of the Evo ICL procedure, which is its potential reversibility. Currently, Evo ICL procedure is the only procedure of spectacle removal that is possible on the human eye, which is potentially reversible, because your eye as such is exactly the way that you naturally have. We are just adding a very thin biocompatible lens in the eye, which can be explanted if it is required. However, such requirements are very rare in our more than 15 years of association of these procedures. As a patient, when you undergo Evo ICL procedure, I am sure that this will be most comfortable and painless procedure you have ever undergone in your life. The procedure itself is a 5-minute quick painless procedure with very quick recovery. The procedure involves a very small cut at the corner of your cornea, which is approximately only 3 millimeters, through which we implant a very delicate implantable Collamer lens, which is your ICL, and the whole process will take only 5 minutes. So let us talk about the care that you have to take after ICL surgery. Fortunately, the ICL surgery requires very minimal aftercare. It is also the surgery which is known to have the quickest visual recovery compared to even laser procedures, and majority of our patients are able to get back to their routine within 3 days of the ICL surgery. Once your ICL surgery is performed, for the first 3 days, you have to avoid contact with the water, with your eyes, rubbing your eyes. Make sure that you put all the drops as per prescription of your eye doctor, and use protective goggles so that you are away from dust or any eye trauma. However, after third day, you can start routine work, including your computer work, although your eyes continue to heal even after that. But 3 days is good enough time to achieve more than 90 to 95% vision as per our experience of this Evo ICL procedure. So let us talk about the global experience of the Evo ICL procedure. ICL surgery has been around for a very long time. Actually, the first ICL was implanted approximately 30 years ago. And ICL has been US FDA approved as a safe procedure for spectacle removal for more than 15 years now. More than 20 lakh, that is more than 2 million implants have happened around the world, and I have been personally implanting ICL since 2009, and I've done these procedures in Europe, in US, and also in India. Currently, we do very large volume of ICL procedures, and we are the highest volume center for Evo ICL procedures in the Western India since many years. I'm extremely happy as a surgeon with these procedures, and I find my patients very satisfied and thrilled with the outcomes of this surgery. You know that many doctors themselves have undergone this surgery with us, and very recently in the US, brother-in-law of our superstar Priyanka Chopra, Joe Jonas, also underwent himself a ICL procedure successfully and has seen the benefits of this procedure with its safety and its quality of vision. Evo ICLs are patented technologies by Star Surgicals, who have their manufacturing plants in Nidau in Switzerland and in California in the US. From these two places, the Evo ICLs are manufactured customizedly depending on your own eye parameters. So once your eye doctor checks your eye parameters, they are all given to the Star company, and then after that they will make the lenses and they will send to your surgeon, which will be implanted in your eye.